Hello, welcome to video 11. For most of the drug war, we've treated public safety and public health as separate responsibilities. Police were expected to enforce the law. Health systems were expected to treat addiction. Too often, the two operated in parallel, rarely in partnership, even though they were often dealing with the same population. This has to change. The hard lesson of this chapter is simple but uncomfortable. Law enforcement operations against drug markets are important, especially if, as the last video highlighted, it is done in a targeted manner, and it must continue. But drug seizures and arrests do not reduce chronic drug use, addiction, or overdoses. And for people who use drugs regularly, they often make outcomes worse. In this first of two videos covering the True Justice book chapter, I'll highlight two important health and justice system collaborations deserving of more federal support. In the second video, I'll return to what happens in the aftermath of drug enforcement operations and explore how to advance much better outcomes. For many people with a substance use disorder, when a problem occurs, police are often involved. What happens in these interactions matter. Offenders traditionally have two choices. They can arrest that drug user, or they can essentially do nothing if they do not see a significant public safety threat. But there is another option. These moments can become life-saving intervention points. If a police officer has the ability to facilitate easy and direct entry into drug treatment programs. This, amazingly enough, is today already happening all over the country. This is what deflection is: police-facilitated access to treatment without an arrest. It requires pre-coordination between law enforcement leaders and treatment providers to arrange access to treatment slots. This is one of the most critical reforms we're going to discuss in these two videos on public health and justice system collaboration. In this video, I also will cover how drug courts have evolved in the face of the rapid increase in fentanyl overdoses a decade ago. These are two important reforms that demonstrate highly effective collaboration between justice and health agencies and represent smart interventions that save lives and cost much less than incarceration. Let's turn to what needs to change to bring these important programs to far more people. In deflection engagements between police and those impacted by addiction, the officer explains that they could help the drug user get into treatment. If the individual is interested and they don't have a significant criminal record, officers arrange a quick assessment by clinician, often on the phone. If the individual is eligible and willing, the officer puts them in the front passenger seat of their car and drives them to the treatment program and makes sure they get checked in. That's it. Why are so many people saying yes to police facilitated treatment entry? I believe it's a combination of two factors. First, this is a much simplified treatment entry process. No cost, no complicated entry procedures, no doubt on whether they would be accepted into the program when brought over by the officer. Secondly, there is something about the authority of the police officer engaging with the individual in a caring way. We need to study it more, but it's already working, and we should keep doing this and advancing this initiative and bringing it to more people. In fact, facilitated treatment entry is working so well, it must be expanded, not only for police officers, but also for other community leaders, including faith leaders, pastors, coaches, school nurses, and others need to get access to treatment vouchers so they, like officers, can also directly facilitate treatment entry to those who they know who are in need of such care. Perhaps this success highlights how difficult treatment entry still is, but maybe it's just a big step that people are more willing to do when they don't have to do it alone, when they have an advocate with authority and standing in the community. We need to expand deflection and study it so we understand more precisely why it's working so well. I am calling for a $1 billion new initiative to bring police, health agencies, and NGOs in the community together to support deflection of treatment as an alternative to arrest of chronic drug consumers, and a center of excellence to support this work. Moving on to drug treatment courts, let me say, as viewers of this video probably know, drug treatment courts are not new, but they are changing in response to the lethality of today's drug supply. Drug courts are diversion. They are post-arrest. They have long been the primary alternative to incarceration for those that have committed crimes directly connected to their addiction. They might be drug selling or committing robberies or other actions to generate money to pay for drugs. But whatever their offense, it's significant enough that an arrest was deemed necessary. Traditionally, pre-fentanyl, such individuals would be brought before a judge and offered, instead of a jail sentence, the opportunity to enter court-supervised community treatment. If they agree, they are released and then they start treatment in about a month. Sadly, in the fentanyl era, some never make it into treatment, experiencing a fatal overdose before their treatment program commences. In response, a new version of drug courts has emerged. It is what I refer to as treatment-first drug courts. Unlike traditional drug courts, these programs initiate treatment within hours or days, not months after an arrest, weeks or months. Sentencing is held in abeyance while treatment begins. The principle here is clear. Health stabilization first, accountability second. Let's keep people alive and get them help. Once people have had a few months in treatment, they'll return to court for sentencing. They will be able to discuss how they're doing in treatment, and the judge will decide what sentence for the crime they were arrested for they deserve. I don't know this for a fact, but I believe it's likely that those who are working hard and doing well in treatment might get a less severe sentence. I hope so. We should expand the number of these treatment-first courts in the country. I'm calling for the creation of 500 treatment-first drug courts to reduce overdoses of addicted drug offenders, and $250 million federal dollars to support this expansion. In the next video, part 2 of the Justice and Health collaboration, we'll look honestly at what happens to drug users when their drug dealer is arrested. It's often, unfortunately, not good. See you on the next video.